My baby is Aussie, but I'm on a student visa, the comedy and chaos of it all. There's a certain kind of confusion that only international students in Australia understand. You've just mastered using a washing machine without blowing it up. You've finally accepted that how you going doesn't require a destination, and now, surprise, you're having a baby. In Australia. On a student visa. Let's talk about what happens when a child is born in Australia to parents who are not citizens or permanent residents, but brave warriors on student visas. The whole process is like ordering a burger but accidentally being served a buffet with extra side dishes you didn't expect to pay for. You and your partner have been on a student visa, budgeting like professional economists. One can of beans can last 3 meals if you believe in yourself. Suddenly, you find out you're pregnant, and while you're still trying to pronounce Woolloongabba, you're about to become a parent. Now let's dive into the whirlwind of Aussie baby logistics for student visa holders. First, the big question, is the baby Australian? Surprisingly, the baby is not automatically Australian. Yeah, I know, plot twist. Australia follows the law of jus sanguinis, law of blood, rather than just solely law of soil. So even if your baby is born on this golden land of kangaroos and overpriced avocado toast, they only become an Australian citizen at birth if one parent is a citizen or permanent resident. But don't cry into your Vegemite just yet. If your baby lives in Australia until the age of 10 without leaving for extended periods, they are automatically eligible for citizenship. So yes, you're raising a tiny Aussie in training. You just need to stick around long enough. Now let's talk about the elephant in the room, Medicare. You're on a student visa. That means no free Medicare. Unless your country has a reciprocal health care agreement with Australia, you're on your own. Unfortunately, many countries including India, Sri Lanka, Nepal, and Bangladesh aren't on that golden list. So how does Medicare work for your newborn? Here's the twist. Once the baby is born in Australia, they may be eligible for Medicare under a few specific conditions. For instance, if the baby is born in a public hospital, and the parents apply for a temporary Medicare exemption for the baby based on compassionate grounds, there's a sliver of hope. But usually most international students have overseas student health cover. Now, OSHC may not automatically cover your baby unless you've upgraded to a family policy, which, let's be honest, costs more than your semester tuition and half your soul. If you didn't upgrade in time, then you're out of pocket. Meaning ultrasounds, delivery, postnatal care, it all comes with a bill long enough to use as wallpaper. Some private hospitals will politely hand you a quote of $10,000, $15,000 and say, "Good luck, mate." Dealing with the hospital. When you go to register at the hospital for your delivery, they'll ask for your visa, OSHC details, and sometimes even your dog's birth certificate. Okay, not really, but it feels like that. If you're not covered properly, they'll gently guide you to the billing department faster than you can say, epidural. Many student parents opt for public hospitals because they are more affordable, and in emergencies, public hospitals won't refuse care. Australia still has a heart, but they will send you the bill later, and yes, they will find you. Government support, is there any hope? This is the part where you might think the government rolls out a baby welcome mat and hands over diapers and dollars. Not quite. As international students, you're not eligible for things like Centrelink payments, paid parental leave, family tax benefit, or the newborn upfront payment. Those are strictly for citizens, permanent residents, and select visa holders. You'll have to fund everything on your own. However, there are some community organizations and local councils that can help with baby goods, classes, or parenting support. They don't ask too many questions, just show up looking sleep-deprived and confused, and they'll know you're one of them. Registering the birth. Once your baby is born, you have to register their birth through the Births, Deaths, and Marriages Registry of your state. This part is simple. Finally, something is. After you fill in the form, your baby will receive an official Australian birth certificate. Is the first step in giving them a legitimate Aussie identity. Then comes the next step, applying for a visa for your baby. Babies don't just become citizens, they need a visa too. Visa for the baby. Wait, babies need visas too. Yes. It's hilarious and weird, but yes, your newborn needs a visa to legally stay in Australia, even though they were born here. You can apply for a dependent visa for the baby under your student visa stream. This involves medicals, fees, and a whole bunch of paperwork that makes you wonder if the baby also needs to write an SOP and submit a resume. You must notify the Department of Home Affairs within 28 days of the birth and apply for the baby's visa. If you delay, the baby becomes unlawful. Once granted, the baby gets a visa grant notice just like you. Yes, your baby now officially has a visa before they can even hold a spoon. Citizenship later, the magic number is 10. So when does your child become a real, fair-dinkum Aussie? Once they turn 10 years old and have lived their entire life in Australia, they automatically acquire citizenship by confetti. Just kidding, it's by law. You'll need to apply through the citizenship by conferral pathway if you or your partner become PR holders later on. In that case, your child might be eligible sooner. But if not, don't worry. They'll still get there. Slowly. Childcare, vaccination, and schools, the practical jungle. As a student parent, once your baby grows a bit, the practical madness begins. Daycare is expensive. Think $100, $180 per day in most cities. And you don't qualify for childcare subsidy. If you want to work or continue your studies, you'll have to budget for daycare. Or beg grandma to fly over, and even she needs a visa. Vaccination is crucial and free under Australia's national immunization program. Even if you're on a student visa, public immunization services will usually vaccinate your child at no cost. School. Public education is generally free for Aussie citizens, but if your child is still on a dependent visa, some states charge international tuition fees. Again, more money, less logic. Funny things you'll encounter. Trying to explain to Centrelink why your Aussie baby can't get benefits and watching their system crash in confusion. Seeing the look on immigration officers' faces when you ask if the baby needs a health insurance policy too. Calling your baby the only true Aussie in the family while you're still figuring out what ARVO means. Crying when the baby gets a Medicare card while you're still paying full price for Panadol. Realizing your baby's Aussie passport might come before you get PR. The audacity.